My name is David Kernick. This is our third series of discussions here at the City of London Migraine Clinic. I'm the lead GP at the Royal College of General Practitioners for Headache, and I'm with Professor Macgregor and Alison Frith. The third session, we want to think a little bit about the migraine process itself, what's going on, and how this might manifest itself. And I'd like to start off with a very simplistic model. This model is a little contested, but I find it quite useful. We all have different ways of explaining what's going on to our patients, and I find this model particularly useful. Just to orientate ourselves, this is my rather bad impression of the brain. Here's the spinal cord, this is the top of your brain, and here's your front. And what we recognize is that deep in the middle of the brain, we have what's called a migraine center, or a migraine engine, or a migraine generator, if you like. This is where the migraine process actually originates. And we all have very different thresholds for this migraine center. For example, I'm fortunate I don't have migraine. But if I'm stimulated enough with drugs or chemicals, this will trigger off my migraine center. If you suffer from migraine, you have a much lower threshold of this migraine center, which can be triggered off much more easily. So what triggers off this migraine center in the first place? Well, what we think is happening is that the first thing to occur is a wave of electricity that spreads across the lining of the brain, or the cortex. And this is what gives rise to the phenomenon known as an aura. And we can actually measure this wave of electricity. It's traveling at about 3 millimeters a minute. And depending on which part of the brain it's transversing depends on the type of aura we're experiencing. So for example, the part of the brain that processes visual signals is at the back. So if this spreading wave of electricity is at the back of our brain, we have a visual aura. If it goes over the part of the brain that's affecting our speech, then we have difficulties with our speech. So the aura is the first thing that triggers off the whole process. This is then picked up by the migraine generator and triggers off the migraine attack. Now the brain itself, the substance of the brain itself, has no pain fibers. So signals are sent to the surface of the brain, the lining of the brain, and this causes an inflammation in the blood vessels of the lining of the brain, and it is this inflammation that gives rise to pain. So the migraine attack, the actual pain of migraine, is in fact an inflammatory process. So that's a very basic model, which I find useful. There's one or two useful points just to pick up here from a clinical perspective. First of all, overlapping this migraine generator is the area of the brain that's responsible for nausea and vomiting. So as soon as this migraine center starts warming up, it triggers off the nausea and vomiting center, which sends off signals down to our stomach, and we get nausea, vomiting, and in some cases the vomiting is actually worse than the headache. But from a clinical perspective, this is important because any drugs we take once this process has started are not going to get well absorbed into the body. They're going to get held up in the stomach. So often we like to use medication that will help empty the stomach and move the drugs on so they'll get absorbed in the gut. The other interesting feature in this part of the brain is that the nerves from the back of the head, from the shoulders and from the neck all converge into this area and very much again overlap with the migraine center. And a lot of people we see in clinic come in with neck pain. They've been to see their chiropractors or their osteopaths thinking there's something wrong with their neck. In fact, what I think is happening is the migraine generator is probably firing sort of a low-grade migraine. It's not triggering off a migraine process, but it's ticking over and it's sending off signals back down these nerves, which we're experiencing in pain in our neck and shoulders. So I think it's a very complex system here. And what happens then is the muscles may go into spasm, which sends signals back into the migraine center, and there's a very complex two-way flow, which can be quite important in triggering off a migraine process. So that's a little bit about a model which I find quite useful in explaining what's going on. We're going to now move on to having a think about what can trigger off this process and the various phases of the migraine attack. We've looked a little bit about what might be going on in the brain in the migraine attack. I just wonder, Anne, in some ways, is the brain of migraine sufferers different from the brains of people who don't suffer from migraine?
I think there are quite clear differences in that people who experience migraine are much more sensitive to stimuli. So, for example, they will be much more sensitive to light, to sound, to smell than partners or friends of theirs who don't experience migraine.
And it seems that they're more responsive to changes and things. They can't cope with change as well as perhaps people.
That's very true. I think the people who have migraine, their body is much more like routine. Right. So change is a bad thing for somebody who has migraine. And it's really, the routine is down to sleep, to eating, to all those sorts of things. Any changes from that a person with migraine is less able to tolerate.
I wonder, Alison, if we can now look at the actual phases of the migraine attack. I'd like to look at 4 phases: the prodrome, the aura, the headache phase itself, and the postdrome. I wonder if you could just take us through those phases one at a time. Should we start with the prodrome? What is a prodrome? How do we recognise it?
Prodrome is really the first part of the migraine attack, and that can start really 24, 48 hours before the headache part. So it's really part of the build-up to the attack, and people can describe different features in different extremes. You can be sometimes very, very hungry or not hungry at all, and often crave sweet things. Your mood can be quite elevated, or really you can be quite low, clumsy, lethargic. You can yawn a lot, feel very tired, and have quite blurry vision. So a number of different things can be happening long before the headache.
And how long before that can the headache actually happen?
Really a day or so before the headache, which is very important when we start to think about what may trigger a migraine, to actually look even before the headache starts.
And how many people would get a prodrome?
Many people will say they have a prodrome, but they don't always recognise what the symptoms actually are. They think it might be something else, not necessarily recognise it as the beginning of their migraine attack.
Right, okay. So prodrome, from the prodrome we move on to an aura. Not everyone gets aura, probably about 30% of people get an aura. Could you just talk us through some of the main features of aura? What are the most common types of aura that you see in the clinic?
The vast majority of migraine aura is what we call visual auras. 99% are. It's when you see the bright lights, for want of a better expression, in your visual field, which can often take the form of a jagged crescent that moves across your field of vision. And people think that it affects just one eye, but actually if you put a hand over the affected eye, you can still see it, because it's not coming from your eyes, it's coming from your brain. Typically these kind of symptoms can last anything from about 5 minutes up to an hour, again before the headache starts.
And we talked a little bit about auras being caused by this wave of electricity. So this I guess explains why auras are always changing with time. They're never static. Visual disturbances are changing, pins and needles are moving up the arms. This is always the case with aura, I guess. I
think that's, people are quite often worried that they're having a stroke or something when they have an aura, particularly when they have their first one. But as Alison was saying, she described it as bright. And you know, if people are having a stroke, they often describe a sort of black curtain coming down across one eye, or they will develop weakness in an arm or one side of the body. That's very different from a migraine aura, which starts often as a little bright spot in the visual field. 2 eyes rather than one, but as Alison was saying, perceived in one eye. And this little bright spot will gradually expand. And if you ask somebody to draw in the air what they're experiencing with their aura, they'll often describe that. So it's a progressive, not sudden development of symptoms, and comes on before the headache, lasts up to an hour, usually resolves before the onset of the headache. So quite distinct from sensitivity to light or general spots in front of the eyes that can occur during the prodrome.
And you can get some strange auras, of course, can't you? Very rarely, but nevertheless.
Very rarely you can get strange auras. I mean, I think you can probably describe some better than I.
Well, I think probably the most strangest one is the Alice in Wonderland syndrome, where everything is distorted and upside down, very much like your Alice in Wonderland world, and all sorts of other things, problems with your balance, buzzing in the ears. So there's a whole range of different auras. But as Alice said, visual auras are the most common, and by far, most people will get a visual aura.
Most people get used to the kind of aura they have, so they know what's happening when they've had it before, as opposed to something different that's very sudden, which is more of a concern.
But I think it's important to make the point, you can get migraine, you can diagnose migraine without an aura. I think a lot of people think if you don't get an aura, you don't have migraine.
And you can have both types of migraine in one person. And often the people who have the aura don't appreciate the other headaches that they have are actually also migraine as well.
And of course you can have aura without the headache, which is even more confusing.
Although I think people do describe a sort of general mild sort of muzziness often after they had the aura. Things aren't quite right. But I think the aura that worries people most is the sensory aura, where they sort of often tell us as medical professionals that they can't move their arm. But actually more what they're describing is that funny feeling when your arm has gone to sleep and you feel that you can't actually move it, but you can still pick it up and do things.
Right.
And that funny sort of feeling of it tingling, sort of moving up into the side of the face. And that can be quite scary for some people, but is not uncommon as a migraine aura.
And then, Alison, there's the headache phase itself, which is probably the one that bothers people most of all.
That's the one that bothers people most. The headache can be absolutely excruciating. People describe it as having a dagger or an axe through their head, that they just want to rip their brain out. It's usually one-sided. You feel that you just want to lie still, but you can't get comfortable. Whatever you do, it feels absolutely dreadful, completely stops you from what you're doing. And the headache itself can last anything from 3 hours up to 3 days. It can go on and on and on. It can be associated with extreme pressure from the neck upwards and just be so debilitating.
And sensitivity to all sorts of things as well, heightened sensitivity.
Things that wouldn't normally bother you, like brushing your hair or just your head against the pillow, can feel so much more painful than normal. You're very, very sensitive to smells, sounds. You begin to feel sick, but the head pain is just excruciating.
And I think here is the important differentiation between cluster headache. Cluster headache sufferers will want to pace the room. Migraineurs will always want to lie down.
Movement seems to make the migraine so much worse. So generally people just want to rest, want to stop what they're doing, and ideally lie down, preferably sleep.
Hide away from the stimuli.
Yeah.
We talk about the stimuli being important for migraineurs. In a migraine attack, that's what they want to hide.
In a dark room, away from the light.
So the pain, 3 to 72 hours, 4 to 72 hours. Then in some people, a postdrome, which is quite interesting.
That's the bit after the headache, and it's actually still part of the process. We often hear people describe as if they've been through a mangle. It can last a day or two afterwards, where you just can't concentrate, you can't function properly. The sickness and the headache has gone, but the process hasn't finished.
Although for others, they will describe a complete sense of relief. That it's all over, they know that they're going to be okay for a little bit and they can actually do whatever they want for a very short time after that migraine attack and be migraine free. So it's short-lived.
It's quite clear that migraine is more than a headache. It's a disease process that affects a number of parts of the body.
It's a whole process, and the headache is just part of that process.
And I think we mislead people in a way by saying that a migraine lasts from part of a day up to 3 days, because that's only the headache bit, and the whole process is at least 1 or 2 days either side of that.
Okay, that's a little bit about the headache mechanism. Thank you. In our next session, we're going to move on to talk a little bit about triggers, lifestyle, things that can alter this threshold to the migraine engine or migraine generator that we've been talking about. Thank you very much.